Welcome to the HFMA Talk podcast, the podcast for NHS Finance. I'm Alex Hunt, Content and Social Media Executive at the HFMA. In today's episode, we're going to be sharing a conversation between Lisa Robertson, Senior Policy Manager at the HFMA, and Su Rollason, Deputy Chief Executive Officer and Chief Finance Officer of University Hospitals Coventry and Warwickshire. Su reflects on her career and her role in leading one of the NHS's most ambitious financial and operational transformations. With 25 years of experience in NHS finance, she has become a respected and influential leader, championing excellence in financial management, system leadership and professional development, as well as resilience in the face of continued financial and operational challenges. Su was recognised for her contribution to the profession when she was named Finance Director of the Year at the HFMA Awards in 2024. This recording has been edited from a fireside chat webinar that took place in March.
My name is Lisa Robertson. I'm a Senior Policy Manager here at the HFMA, and I'm absolutely delighted to be joined today by Su Rollason. She is the Chief Finance Officer and Deputy Chief Executive at University Hospitals Coventry and Warwickshire NHS Trust, and she won the HFMA Finance Director of the Year award. The award is actually one of our most prestigious and hotly contested of the HFMA awards, and today we do get a chance to celebrate the 2024 winner and find out a little bit more about her career journey and why she received this year's award.
Thanks, Lisa. But just to give you a little bit about myself, I suppose, and where I am now. So I'm at UHCW. It's one of the largest teaching hospitals. It's one of the big leading trauma centres. We've also got a big surgical training suite, so some big pieces of innovation and cool technology in there. One of the first wave PFIs as well, which opened in 2006. And I was lucky enough actually to be, to witness, if you like, the opening of that around 2006 as well. We lead on a number of the big sort of specialised services. And we became associated with Virginia Mason, which I know we'll get to talk about in a little bit more detail later. And that was a few years ago, and linked to what now is our improvement methodology. So I'm sure we'll go through that. And clearly, one of the underpinnings around all of that is about our culture and visible leadership, and I very much align with that as such. In terms of what I've done before, I've been at various places, but I was also the system finance lead for 3 years, and that was before the formation of the ICBs as such. And once the ICBs were formed, I stepped away from that and focused really on the role as Chief Finance Officer at UHCW, as well as, of course, as being a Deputy Chief Exec now, which I'm very lucky and privileged to do as well. My journey to CFO, so I suppose quite interesting, really. I'm going to start from the beginning and probably give you a bit of a story about my history as such. So went to university and I was lucky enough to get a scholarship to do my master's. And it was during that time I started to really think about what I wanted to do. And I applied to various graduate training schemes at the time. And I remember I got 2 offers on the same day. And one was the NHS grad scheme, and another was actually a well-known car manufacturer. And I always remember my mom saying to me at the time, this was a number of years ago, as I'm sure you'll realise now, looking at me, that I've certainly got grown-up children of my own. But I remember my mom saying to me, well, what do you think you want to do? What do you think actually matters to you? Is it about counting cars, and that's no offence to people who count cars, or is it about trying to change and make a difference to patients in one of the most respected organisations in the world? And it was at that point I thought, you know what? Yeah, I want to be part of the NHS. And I joined the grad scheme. And I started off my journey on the grad scheme, and then I was fortunate enough to be taken on then for the new hospital project at Birmingham. But I suppose the point of my opening story is the reason I chose the NHS was clearly around my values. and what I really believed in. And I suppose as we go through all of this journey, but also some of the real challenges that we face now, actually it's the values piece that has kept true to me all the way through. So it's something I really believe in. And I was lucky enough, as I say, to work on the new hospitals project. During that time, actually a number of different things happened. One of the things was that in the middle of doing all of the capacity modelling and the revenue costing and all the bits of the UP, actually the capacity planner left, and they all looked around the room and thought, who could be good with a spreadsheet? And at that time I was quite technical, so they looked at me and said, well, actually, would you be able to do that as well as the finance side? And I suppose, again, the reason why I sort of give a little bit of that history is because it was quite a leap then to do that. And it was really around seizing the opportunity that presented. And the opportunity, as it was to do something that I hadn't really done before, but really stretched myself to be part of that programme. And then I finally ended up at UHCW along the way, and I've been here for a number of years. I actually started off as a commissioning finance manager at UHCW, and it was at the time when PBR was being implemented, so payment by results. And from a UHB perspective, University Hospital Birmingham perspective, we'd been an early implementer. So when I moved across to UHCW, that was one of the core parts of my role. And it's funny, really, because having been brought up then, if you like, and been central to that regime, it's quite interesting to find where we are today with the discussions around actually what is the right payment mechanism, what would work and what would incentivise behaviours as we move forward. And then finally, after being appointed CFO in 2018, I find myself as Deputy Chief Exec today. And certainly the role has changed over that time period. So I think, it's been an interesting journey, but I think you almost got the spoiler at the start, didn't you, in terms of where I am? But it's definitely been a learning journey.
Thanks, Sue. It sounds like you've had quite an interesting and a journey with taking opportunities as you've gone. And I think when you mentioned the values being the focus of why you joined the NHS, that will really resonate actually with most of our audience, to be honest. But I know when the Trust put you forward for the award, they particularly highlighted your true commitment, I think it was praised, to personal development, which would be really interesting to explore a little bit more in terms of what you see as some of the key leadership qualities that are essential for driving the financial strategy and system-wide transformation in the NHS, and how we can actually support others with their own personal development in this area, because it's not something that you just kind of are born with, is it? You kind of learn it over the time. So yeah, thoughts on how we develop that as a skill set?
Absolutely. And I think in terms of personal development, I always think it's a mixture, isn't it, of the things that, if you like, you have formal learning and formal training, and also those things where you do seize the opportunities and actually creating within yourself a sort of, I know they call it sort of growth mindset, don't they? But, it's about the continual improvement and continual reflection on what you could do better. And it's as simple as that, really, in many respects. But I think for me, in terms of leadership qualities and qualities about how to develop as a person, it's very much about, I've mentioned the values. I can't say that enough as such, because I think that's really, really important. But actually, it's then about seizing those opportunities, making the most of them, thinking about how you can really utilise networks. So HFMA is a great network for that. The institutes are a great resource as well. But actually, just the wider interaction with people and understanding how different individuals tackle problems. I think that's one of the key learnings from my side. But actually at UHCW, as part of our level 3 accreditation, and again, I'm sure you're going to ask me a few questions on that as we go through, but actually one of the thing I'm most proud about is really the the sort of training and development piece that we've done within our own organisation around that, and particularly the apprentice to CFO programme, which I think really gives people the opportunity to learn, develop, and get to a point where we have a finance function of the future, not just the one that we see today. So in terms of that, I think that's what I would focus on.
In terms of people's development and support that we need to give each other, I mean, resilience is something we talk about a lot, isn't it? And uncertainty always breeds the need for good leadership and support. So I don't know if that's a good time to take your reflections on how you're going to try and support teams with that bit of period of change and uncertainty.
Absolutely. And, I honestly believe in openness as a key value as well, and making sure that everything I know I try to obviously communicate to my teams. It will be a real challenge, and it will be a period where actually we know that finance is one of the most resilient areas in the NHS. We are good at leading change. We are good at coping with change. And we need to support not just within our own functions, but also outside of our functions now, to actually show how improvement and how effectively we can redesign things to make things better, and to step up to the financial challenges that we now face. And I think we do have that mindset. In terms of, my own functions, or as I said, I always intend to be open in communication. But I think, it's really important, and I mentioned networks before, but it is really important we maintain our networks and we continue to talk and we continue to have that communication across organisations, across the HFMA, to actually understand how people are feeling, how we can adapt to this, and how we can meet and rise up to the challenge.
Absolutely. So, and I think one of the challenges that we always facing, it's kind of the perennial problem, isn't it, is how do you balance that need for financial stability now, that's perhaps people call it short-term thinking, with the imperative and the drive and the why we're here to innovate and improve those patient services, sometimes being quite long-term change programs. Have you got any thoughts about how you try and balance the two?
So there's two things I would just say. So the first thing is, obviously, in terms of improvement and the immediate financial sustainability, they don't have to be mutually exclusive. There's a lot of stuff that improvement actually also improves financial sustainability. And, if you look at clinically fragile services, then they tend to be the ones that aren't financially sustainable as well. So there's a lot of overlap there. If you've got services which you're having to put in a lot of agency, for instance, and hence they are fragile in that sense, then that causes a financial pressure. The same as, some of the quality impacts. So if you've got high infection rates, high readmission rates, they have an adverse impact in terms of financial sustainability. So absolutely, they go hand in hand. But of course, we also know that financial sustainability doesn't just mean in-year financial balance as well. That means a much longer term look at finances. And I think really that's where we've got to start to think and put credible mid-term and longer term plans in, as well as responding to the immediate financial challenge. And no doubt that will be a focus as we start to think about how we redesign workforce, how we redesign services, as it should rightly be. I think it's certainly going to be an immediate challenge, and I don't think we can avoid that. And I think your point about some of those things we know. So some of the key principles in the 10-year plan as such, and the operational guidance around the three shifts, we know some of those things won't necessarily all achieve financial sustainability in the very short term. But the question is, how do we balance out those things that will deliver in the longer term with actually some real scrutiny around what we do today and some quick stuff that we can then hopefully create a glide path that makes us longer term financially sustainable.
Absolutely. I think your point around them not being mutually exclusive is worth reminding ourselves when we're kind of challenged along the way. But can I move us on to one of the examples you've been involved in, Sue? So I know when you submitted your order, you talked about the waste reduction programme that you've been involved with, and I know that made a significant reduction of 58 million, actually. What were some of the biggest challenges you faced in achieving the efficiencies on that whilst maintaining that high quality care? Can you tell us a little bit more about that?
Absolutely. Like many, I would imagine that, and I've been really open with the audience, the post-COVID challenge of engagement and the real sort of focus on finance is something that we're now getting back. But I think it's fair to say that has been a challenge, and it's not necessarily been at the centre of what people's focuses have been. I think in terms of just that operational and financial balance as well, like many, how do you get the right risk tolerance? How do you get the right approach to quality impact assessments? How do you make sure that actually you're not adversely impacting? But I think for us, it's very much around UHGWI methodology. So, in terms of our whole approach, it's about improvement and it's about patient-centred improvement. And when we talk about improvement, I think it's quite interesting because people naturally assume, therefore, that all of those things such as grip and control don't apply. It's almost a second. That is not what improvement is about. Improvement is very much around redesigning processes, making things standard work. So you reduce variation, and then actually you understand then what some of those key control measures need to be. So you look at things such as rosters and rota management. You look at how you're going to redesign jobs. You look at all of those things, and actually that becomes your standard way of working moving forward. So actually what you're creating is your control environment. And I think that's quite important because otherwise people walk away with this assumption that quality improvement means, you've got something very fluffy over here that from a finance perspective, you can't actually either quantify or you can't hold people to account. That is not that's not what it means. But what it does mean is for us actually that redesign piece with quality metrics at the centre is the thing that takes the precedent. But we absolutely then look at how that transacts into measurable financial outcomes. And that's the thing that then gets put within our actual plans as such and our financial sustainability.
And actually, when you talk about control environment, I think sometimes we can fall into the trap of thinking that's a written down thing, that's a process, that's a procedure. But actually the people side of that and the implementation by people is huge, isn't it? So I know you were involved in the EPR implementation, weren't you, in Country, one of the big ones, and that obviously involved lots of people, finance, clinicians, everyone. How did you work up those strategies to make sure something was implemented across the board as it was written to be implemented?
Gosh, so the electronic patient record, so it's the largest scope in Europe. It had the largest uptake of the different elements, if you like, across a very large number of staff. So it was those two things combined which made it quite a challenging EPR in that sense, but nevertheless one that will have lots of future opportunities. So I've got no doubt about that in terms of the vision of what we are trying to achieve as such. I think there's a real simple thing around trying to do any big program like that. So absolutely get everybody involved. Everybody has a responsibility as such. And what I mean by that is I was the SRO for the implementation, but actually every chief officer had oversight of the different elements, and clearly in terms of impacts to the organisation, chief operating officer, chief medical officer, chief nursing officer, so just to name just a few. and actually chief people officer in terms of the training agenda, absolutely had each element of that. So everybody was engaged as such. And I think, we did get a real sense of purpose and a real sense of pulling together. It was a real significant event in terms of our digital journey, and it now means we can build quite a lot on top of that EPR. I will say it's still got some challenges, and we had challenges at the time, and we still have challenges. So I'm not going to say there aren't any, but it was deemed one of the most successful technical implementations of any EPR. So that's really positive. And from my own perspective and my own portfolio as such, in terms of my teams, I have to say finance teams are brilliant. I will say that now. I'm so biased, I really am, but they are just brilliant. So certainly, if I go back to COVID, when we had to do all of the PPE type delivery and the oversight and, cups of tea, whatever it might be, finance were right there, putting themselves forward to get involved because they knew it was the right thing, the right thing to do. Again, I think if I just take that forward then to the EPR, when we were looking at navigator rotors, when we were looking at any additional sort of duties, if you like, that finance could help with, they were right there at the centre. They were the first putting their hands forward to say, actually, we'll be part of the rotors. We'll cover some of the weekend shifts. We'll do. So I have to. I'm very proud always in the level of engagement that my finance teams have with anything we do, and that's because I think going back to that values piece, they really believe in the patients and they really believe in making things better and have a real desire to be at the centre of that. So. Yeah, so definitely a whole hospital approach to the EPR without question. But in terms of finance, absolutely at the centre of it, and couldn't be prouder of them for it as well.
And you mentioned as well their learning opportunities, and you touched on a couple of those. But is there anything that you would take away from that experience that you would apply to other programs, or that you think is almost a prerequisite to any similar programs?
So I would say that in terms of any program, and certainly an EPR, is to get every stakeholder excited and involved, make them part of it. So, make sure that you've got those right people actually responsible for the things that you need to lead the change. Something like an EPR, and I think it goes with anything that you do actually certainly within a healthcare setting. It's that absolute co-design between the clinical and non-clinical as well. So you have to have that. Clearly, just in terms of the making sure that you've got the plan rehearsed, you understand every risk and then you can try to mitigate in advance, if you like, any risk that you think is going to come up. So I think that goes for any program. But and the other thing I should have mentioned, really, of course, is that we learnt from lots of other implementations that had gone before us, and that goes again with anything that you do. I think learn from others, don't try and reinvent the wheel. Hence the reason why we have offered ourselves out, and we continue to do so for any program that's going live in the future. Please do come and speak to us. We will be as open and transparent as we absolutely can be about, what we did, but also, where you could improve upon the things that we did as well.
And I think learning from others takes us quite nicely on actually to your experiences around the Virginia Mason improvement principles and embedding those within the team. How has that worked? What impact has that had?
So really big. So, I mean, I don't know if the audience knows a lot about Virginia Mason as such. So Virginia Mason is a hospital in Seattle. It's slightly widened now from the original scope, but it was classed as the safest hospital in the world. Yeah, so which is why it was felt that it would be really good for the UK to learn from and adopt some of the principles of the improvement methodology. But their story actually started in 2004. And it started with a lady called Mary McClinton, who unfortunately absolutely was an example of where things went wrong. And she was injected with an antiseptic which shouldn't have been injected with, and she became, if you like, the catalyst for Virginia Mason then to really sort of step back and say, look, we've done the wrong thing here. How do we make sure that this never happens again? We need to make it that almost the safety culture that we create, the things that we do, are so embedded within our culture that this event couldn't happen. And so they did so, and they went on a journey, and they adopted many of the methodologies of Toyota, but then completely redesigned those methodologies and adapted them to be appropriate for a healthcare setting, which I think is really important, because we've all heard of lots of lean methodologies. And depending on how long you've been around, you've probably been through several of them. But the key thing about this was it was really around adapting it for healthcare and making it mean something in healthcare, but actually also looking at it from the perspective of not just a quality improvement methodology, but also a production methodology, how you run your business, essentially. So this is where we got to in terms of the then being named as the safest hospital in the world. And they went through quite a journey in that. But in 2015, 5 hospitals were chosen to basically partner with Virginia Mason to learn and to bring, in many respects, and test that methodology in the UK. And we were lucky enough to be one of those hospitals. And as a consequence, then we developed that methodology, and it's now our UHCWI methodology. And really, I mean, it's simple in many respects, but then it's about an entire cultural change. So nothing with an entire cultural change is that simple, but it's really about putting the patient at the centre of everything that you do, and thinking about then essentially how you redesign in that context. And for ourselves, it really works around Tachio Ohno's wastes. So all of the wastes around whether it be processing, whether it be around walking, for instance, whether it be about wasted human potential. So that's around that whole where are you working, if you like, in terms of the license, as we like to call it in the NHS. And it really looks at all of that, and it starts to say, actually, how do we get rid of all these things to make it better for everybody? So how do we make it better for the patients? Actually, as a consequence, we remove all of those things that the staff also don't want to be doing. The staff don't necessarily want to be walking around several times to try to find something, or, have a barrier of a process. They can't actually move forward and improve things for the patient. So it really puts all of that around it, and then says, right, okay, that's how we're now going to operate. And I think from the finance perspective, so we obviously support a lot of the events, but also we have absolutely adopted that methodology within the finance teams as well. So as part of our journey, not only are we supporting all of the patient-centric as such, we also adopt all of those methodologies within finance. So whether it be faster reporting, whether it be around how we do different processes. And, so if we had a whole piece around budget environments, for instance, we take the same approach. And all of my teams have done either full sessions or what we call passport sessions, which are shorter versions, to make sure they understand the terminology, the approach, and then we make sure that then gets used within everything that we do. And we have a production board. So we have a production board and a huddle board in finance, which we discuss all of the key KPIs and where we are, and make sure that we're on track for delivery. And that actually, you'll see the production boards and huddle boards are across the entire hospital. So regardless if you're in finance or whether you're in one of the wards, you will see the wards will have their production boards and their huddle boards with all of the key KPIs and all of the key things that they are trying to improve.
Absolutely. And I do love a huddle board. I think it's a nice term, and two,
you just like the terminology.
Yeah. And that's it. It feels quite comforting, which is probably what we need, isn't it, at the moment? But moving on from that, your finance team has achieved, hasn't it, the level 3 finance accreditation, which is a brilliant accomplishment. What steps did you take to position the team as best in class kind of NHS finance team? What advice would you give to others on that journey?
So I'll start by saying this, as you would expect. I'm really proud that we've attained the level 3. And for me, it really means something. And I know that sounds... So one of the things that we decided as a finance team, and when I was writing the financial strategy, was that we didn't just want to do a tick box exercise for all of the accreditation levels. We wanted it to really mean something, and we wanted it to really mean that we were improving things. So I think that was important in terms of people's perception of what we were trying to do within the department, because actually it really meant something. And for me, it's a real badge of credibility as well. And I'm not saying that level 1s haven't got credibility, but for me, it was important, particularly in the challenging times that we find ourselves, because actually what you need finance teams to have that credibility in both externally, but also internally. And for me, that also helps give internal credibility as well as external credibility. And so how we actually sort of went about it, I suppose, which is the core of the question, is that, sounds stupid, but the first thing is decide that you're going to do it and decide it's one of your priorities. And you're going to make it one of your priorities because it means something and because you see it as a method to actually make things better. And I think that's really important. And once we decided that, obviously, we needed to set up then a governance and an oversight group to make sure. So we had our finance development oversight group, which led effectively 4 other groups, delivery groups, as we called them, within that. So a professional development one, a stakeholder engagement one, a diversity, health and well-being, and also our governance controls and financial sustainability. And that was all underpinned by the accreditation principles. So I think that was important in terms of, making sure we had the oversight. We started, of course, by doing a gap analysis. So going through and looking at where we were against all of the levels when we first started. And then obviously in terms of level 3, we went through. The one thing I would say as well, because the level 3, it builds upon everything that you have to have maintained in level 1 and 2. We absolutely made sure that we went back and we did the gap analysis over every level, not just the level 3 plus bit, to make sure that we'd embedded absolutely everything of level 1 and level 2. So we did a whole gap analysis. And then we went through each of the areas and really looked at how we could improve things. So we looked at our talent management strategy, looking at how we could further embed the processes that we already had as a trust around our personal development. But some of the things that I've mentioned, so very much around the apprentice to CFO progression route, looking at the competency frameworks, looking at then how we could support lots of other succession planning, business continuity as well. So making sure we refreshed all of that. We had a whole health and well-being, which I know we were fortunate enough to showcase as well. We do lots of celebrations, I should just say, which I think is really important. But also we do and have done lots of team building. So we've done dragon boat racing where I think I lost. I think we did laser questing where everybody shot me. And I was actually the last on the leaderboard. We did karting, and again, nowhere in sight on that one. So we've had a number of team building events, where we can sort of really make sure that we focus on some of those key deliverables as part of the health and wellbeing. Very much around the EDI agenda as well. So looking at how we actually make sure that's one of our key focuses, and actually go over and above almost, some of the metrics, if you like, that we sort of have and we sort of compare ourselves to. But also, I have to say, in terms of engagement, I mean, we had our staff survey, financial management, we had 100% response rate. And incredible. Genuinely, I just can't believe that. And it sounds quite a sort of statement, but given that we've got quite big functions here, I think it just shows just how committed people are. And then finally, in terms of all of our internal governance and controls, and real focus again on those things. But I think in year we've had a number of internal audits which are financially focused, and I think it's fair to say everyone had significant assurance, but actually there were a couple where they were pretty much full assurance. In the end, we ended up not getting full assurance because I think it was deemed that you just can't do that. But I think, all of that redesign stuff in terms of processes and thinking about how we're going to make sure that we've got those controls in really has gone through everything that we've done.
And you clearly have fostered that cultural side of resilience, the innovation, excellence among the team, and give us some examples of how you've done that. I don't know if there's any advice you'd give to people if they feel like they're in a team that's perhaps not got that culture at the moment and they would like to be working in that. How can you kind of break through when it doesn't feel like you're of the common ground, which I think is probably more unusual in finance? I think you're right. We're very lucky with our team, but there will be some people in our audience who are a little jealous of the dragon boat racing and the culture that you've fostered, I think. What can they do?
I would say, from an accreditation perspective in particular, and lots can lead on from that, I think it's a really good assessment. It gives you a really good way to link into other networks, but have a structured, if you like, methodology, a structured framework that you can then improve your function. So if you think that that you may be out of kilter, or you think you could improve things, then I would say put yourself forward to lead some of that. Start thinking, and I hate to say it, but in my experience, it's never just one person who will feel like that. There are probably quite a few people that feel like that. And all of a sudden, if you can get that group together, that then starts to focus on all of those key things that you want to develop, improve, have the ambition to be the best, then actually you're going to create a movement that people can sort of latch onto, with an output that people will recognise as well. And I think that's really important. And as I say, making sure that, and this is why across our teams, that whole thing about tick box exercise, I think that's a really dangerous place to be, because it doesn't engage people. That's just about, there's always a thing about making sure you get the right evidence in the right folder, don't get me wrong. But if that's all it's about, then you're not going to change anything for people who are working in the department to allow them to engage even further in what you're doing for the future.
The HFMA Members Summer Series is back. Following a record-breaking turnout in 2024, this free event is back for its third year, running online from the 17th to the 19th of June. Designed exclusively for HFMA members in bands 2 to 6, the 3-day online event brings colleagues together from across all 13 HFMA branches. Expect expert talks, career development insights and networking opportunities with fellow finance professionals. Plus, with on-demand access for 3 months, you can catch up anytime. Don't miss out. Register yourself or your team today for free. Head to the link in our show notes to sign up. Back to the episode.
Thinking about the future, in your opinion, how is the role of NHS finance professionals evolving? What skills are going to be crucial for future leaders, and kind of what advice would you give to aspiring finance leaders?
So I would say in terms of aspiring finance directors, well, I'll start by saying I think that I've been very privileged to work in the NHS as a finance director and to have my career in the finance profession. I have created and I've formed some great relationships. I've had a great career. I've felt really fulfilled throughout my career. And that's set against what we know is a really, really challenging backdrop at the moment. But I just don't think we can forget the fact that actually it is a privilege to work as an FD in this environment, regardless how hard it is. That's how I feel personally. So in terms of being aspiring, I think the first thing I would say is definitely go for it. That's something I would say. I would say that the opportunities outweigh any of the challenges you may face. But actually, in terms of the skills that may be required, I think there's a big piece now about how you look at bigger picture, how you think about organisations and populations outside of your organisation as well. So the population health piece, acknowledging your part in that, of course, but understanding actually what the longer term sustainability and almost the dependence of the wider determinants of health may look like. I think that's really important. I think data has always been at the centre of the finance role. I think the future will be even more data centric, but probably taking on board now all of those things that we've heard about around AI and both internal to the finance functions in terms of what that can do, but also thinking how, again, we can shape our finances around those populations. What are those insights that AI may give us that we need to think about? And I think when you put those two things together, so when you start to think about the sort of population side, the wider determinant side, when you start to think about the available data that we might have, then it starts to lead us into how do we think about value in healthcare in a different way. And I know we mentioned before about my role in terms of the Value Institute, but I think it starts to make us think about actually, do we need to consider more now what the value equation is and the value of different interventions and different settings?
And you are chair of that Healthcare Value Institute, which is fantastic. Can you tell us a little bit more about the benefits you've gained from your involvement in the Institute and perhaps how people can get involved?
Absolutely. So I've been the chair for a number of years now. And actually, we have changed it from just the Costing Institute to the Value Institute. I will just say now that costing and good costing information is still, and a good sort of data is still at the heart of a lot of that conversation. So I say that because, for a long time, it has been a place where we can represent and we can showcase some of the best examples of costing. I think the Value Institute now goes a step further in the sense of it puts that together with actually the outcomes and starts to understand what that cost outcome equation needs to look like. We're thinking about in that institute at the moment how we do some more case studies. So there's a number of case studies that are available through HFMA now, but how we start to think about particularly the shifts that we the national policy is aiming for. So particularly around the integration agenda, particularly around the digital agenda. So what is the value equation of those different models? Can we start to get some, as I say, some best practice, some understanding around what those frameworks would need to look like? So how do we measure the benefits in that context? And how could then people evaluate and adopt some of those things moving forward? And in terms of getting involved, the best thing to do to start with is please just go to the website and please just start to see what materials are available, what webinars are available, what podcasts are available, have a look to see when the various offerings of conferences might be. So this might be about the value conference. It might be around some of the symposiums that are run, and just really get involved and see actually what would maybe make a difference to you. But the one thing I will say about the Value Institute is that the clinical side is as important as the finance side. So when you look at any of the materials or the conferences or webinars that are available, think about it in the context of, could I share this with my clinical colleagues as well? Could I start to show them what's possible? Could I now start to create a relationship and start to look at some best practice examples that we want to work up in our own organisation? But fundamentally, when I sit around the table at the council, there's some really intelligent, really engaged people all working for the same thing, really inspiring me as to how they're doing things differently. And I think with any network, that's what you get.
Yeah, absolutely. And it is really rewarding, isn't it, working with the clinicians and hearing some of the inspiring stories. So we would encourage people to get involved. Just reflecting back on some of the things that you've talked about around your career, what would you say the highlights are? What has been the most rewarding aspects of your role and that you would remember?
Oh gosh, the most rewarding aspect. So there's so many, to be honest with you, I have to say. I think making it to CFO, was I'll say it now, was for me something that I had, sounds very dramatic to say dreamt of, doesn't it? But it's something I'd worked for quite a number of years, and so that was really important to me. Another highlight of my career, as silly as it may sound, was my 25-year service recognition, and to reflect on all of the things that had happened during that time period, and actually how much the NHS had evolved over that time as well. I think was a real sort of highlight for me. I would, of course, say when I got the award in December, because that was, again, genuinely couldn't believe it in many senses, and have seen some really, some great finance directors get that award. So I was absolutely overwhelmed by that. But I think when I actually look at some of the reflections around what we've achieved improving services and how we've moved forward and how we've supported to do that, whether it be about how we've taken on, say, our community services and redesigned pathways, when we look at some of the, as we mentioned, the EPR, some of the real change, those are the big things for me. But for me, I suppose, and I will just mention this as a final one, is that, when we talked about the level 3 before, actually the bit that I really enjoy is around the developing people and developing the future finance function, because I am aware I won't be around forever, and I'm really keen on ensuring that we've got a future finance workforce that is equipped to deal with the challenges that we'll find ourselves in. And I think that's probably, for me, one of the highlights is when I see some of those people develop as well.
What's been the most challenging role you've done in your career? And I wonder as well, what has helped you stay motivated when it does feel a little too challenging?
The most challenging role. So whether that's about roles or so different ways. So the system finance role. So I was still CFO here, I should just say. This is before there were the actual sort of ICB FDs as such. So I was the system role at the same time as being the provider role, and that was challenging in different ways, because it's all about how you engage across the system. At that point, the ICBs weren't formed, so you are really using all of your skills of engagement and communication and trying to get people to do things without actually any real authority to do so, which is quite challenging. And I was in the system role as we went into COVID. So again, that was quite a challenge in itself. just trying to manage then what needed to be done as we went into COVID. So I think that was probably one of the most challenging. And then we've mentioned it before in terms of what we've done recently. I think probably the EPR implementation, just from a CFO here role, just because it is just so consuming.
Absolutely. And a last question from me. When you won the award, you said that if you can encourage or inspire even one person to realise their ambitions and realise how important finance leaders are in making things better for patients, despite the challenges, that would be really rewarding. And it certainly is a challenging time right now. So what one message would you like our audience to take away from you today, really?
I think it's just say for me, it's remembering just how important we are as finance leaders, finance professionals. And whilst finance is a huge challenge, and we know that, and we can often be perceived as the people who say no to a lot of things, particularly when it's a really a challenging environment, we're also the hope givers. So we're also the people who provide the opportunity. We're the people who can lead through that change. And I think if we all just keep our value sets and our belief and our integrity, then actually we can deliver and we can move forward on that basis.
Brilliant. And I think a perfect place to leave it for today. So thank you so much, Sue. I really enjoyed that chat. So thank you for that.
Thank you to both Sue and Lisa for their discussion and insights into Sue's career. If you enjoyed this discussion, make sure to have a look at what's coming up on our calendar by heading to the events section on the HFMA website. That's it for this week's episode of HFMA Talk. Thanks for listening. Don't forget to subscribe so you never miss an episode. If you've enjoyed the show, we'd love for you to leave a 5-star rating on your favourite podcast platform. See you next time.